Hello, my friends. Let's say you have done blood test for a child and you find out that he has got thrombocytopenia. That means that his platelet count is less than 150,000 per microliter. Now, how would you further proceed? Now, there are many algorithms and there are many pathways which you can follow, because usually the causes can be so many, and sometimes it becomes a very daunting task in order to know what has caused this thrombocytopenia. But I will give you a very simplified approach which would make your clinical life quite easy if you follow this algorithm. So let's say first thing, you note that the platelet count is low, which means that the platelet count is less than 150,000 per microliter. Now, what would you do? Now, simply you look at the other parameters, because obviously you do platelet count as a part of the full blood count. So you would look at the hemoglobin and white blood cell count as well. So let's say the hemoglobin and white blood cell is abnormal. Abnormal means that the hemoglobin is low, or the white blood cell count is low, or is high, or is deranged in any direction. So in that case, the back step to further work up thrombocytopenia would be to straight away go for a bone marrow examination, because you need to know what's going on in the bone marrow. Is the bone marrow hypocellular? Like, for example, the bone marrow might be infiltrated with the fibrotic tissue, which we call as myelofibrosis, or it might be affected by malignant process like a leukemia and lymphoma, which might be causing thrombocytopenia. So it's very important to do a bone marrow examination if with platelet count you find out that there are deranged blood parameters, especially the hemoglobin and white blood cell count. Now, let's say if these two parameters are normal, the hemoglobin and the white blood cell count is normal, then how would you further proceed? Now, in that case, it is very important that the hematologist prepares a peripheral blood smear and examines it under the microscope. So if the pathologist has prepared that, if he hasn't, then you can request that I request a further blood smear on this patient to see what's going on. So they would examine it under the microscope. Sometimes they find out that the thrombocytopenia is simply because the platelets are clumped. It's a clumped appearance under the microscope, and it simply means that this is pseudo thrombocytopenia. Simply the platelets have been clumped. So what happens? This sample needs to be redrawn in sodium citrate or heparin, and it has to be re-examined. The peripheral smear has to be redone. The platelet count has to be redone. Now, if the platelet with thrombocytopenia, if the peripheral smear shows that there are fragmented red cells, the blood cells have been eaten, they are stripped off at the corners, or they are damaged, then it simply means that it is microangiopathic hemolytic anemia. So there is some process going on in the blood vessels which have destroyed not only the RBCs but also the platelets. And the common causes of microangiopathic hemolytic anemias could be your disseminated intravascular coagulation, hemolytic uremic syndrome, thrombotic thrombocytopenia purpura, so on and so forth. If the peripheral blood smear also shows a normal picture, that there is normal RBC morphology, the platelets are normal in size, or let's say they are slightly increased in size, then you can consider a variety of differential diagnosis. The most common is infection-induced thrombocytopenia. So like some kids might be having some viral infection, and after the viral infection, for the time being, their platelet count is reduced. We call it as an infection-induced thrombocytopenia. Sometimes it could be drug-induced thrombocytopenia, as certain drugs are notorious for causing a decrease in platelet count. And especially here, I would like to mention heparin. Like heparin is given in many hypercoagulable states, not very common in children, but anyhow, if it's been given, then you can also consider drug-induced thrombocytopenia. Sometimes you don't know, like in majority of the cases, especially in the pediatric age group, there is no history of infection, there's no history of drug intake. All of a sudden, randomly, like for some unknown reason, their platelet counts have gone down and they've got a petechial spot or something like coming up on their skin. We call that as an ITP, idiopathic immune thrombocytopenia. Remember, if it's a neonate, then you can also consider like isoimmune neonatal thrombocytopenia, or it could be part of a syndrome. Like, for example, If the child is male, he's got eczema and he's got repeated infections and his platelet count is low, then you would be thinking of Wiskott-Aldrich syndrome. And then last but not the least is a list of congenital thrombocytopenias, which can occur because of a variety of reasons. But there's something wrong at the what you call has happened at the congenital, state, where the platelets have been decreased in number. But that would usually happen in the neonates. I told you isoimmune or alloimmune types of thrombocytopenia. Some of them can be associated with SLE, can be associated with neonatal syphilis, and so on and so forth. So this is a very simplified approach to work up thrombocytopenia if you find it on blood test. So simply, if you find thrombocytopenia, you'll just look at the hemoglobin and white blood cell count. If they are abnormal, you go for bone marrow. If they are normal, you do a special smear. Special smear, if shows fragmented, you simply know it's microangiopathic hemolytic anemias like hemolytic uremic syndrome, TTP, DIC. If it is normal, then you will be considering drug-induced or infection-induced or idiopathic thrombocytopenia. So I hope you have liked this simplified approach to work up thrombocytopenia. If you have liked this video, give me a thumbs up. And if you haven't subscribed, please do subscribe. Have a very good day and bye-bye.